After both maxillary and mandibular Easdent impression are scanned, see them in the mouth completely. Good impressions should have a little suction. They should stay in the mouth. However, if the ridge is resolved badly, the impression may not stay. You may need to use some denture adhesive to hold them in the mouth. You have to let the patient know the final denture will either need adhesive or implant support. You have to mentally prepare your patient for adhesive or implant ahead of time. It may be difficult to clean away the denture adhesive completely. That can affect the scanning result. That is why I put scanning the tissue and Easdent impression at earlier steps. Ask the patient, do you feel the bite is even? When you bite down gently, do you feel you bite on all the teeth at the same time? Are you comfortable with the bite? Evaluate whether the maxillary and mandibular jaw are in centric relation when the Easdent trays are in maximum intercuspation. Ideally, when you hold the teeth in maximum intercuspation and guide the patient into centric relation at the pre-measured VDO, after the moldable material is set, the centric relation should coincide with maximum intercuspation. If you do get the two coincide, you can have the patient bite down and scan the bite relationship in the mouth. However, errors may occur during the procedure. If there's a discrepancy between the maximum intercuspation and centric relation, guide the patient's jaw into centric relation and record it with the bite registration material, then scan the bite relationship in the mouth with the bite registration material in between the maxillary and mandibular Easdent teeth. Try to scan more area even if the software has already given you a green check for the bite scan or both arch scan has already moved to the bite scan. When you are scanning for the bite, you may have experienced that as you scan more areas, the arch may jump a little bit. That shows when you scan more areas, the software will give you a little different bite relationship. The bite built by the software with less scan may not be accurate, and you may have to do extra occlusal adjustment at the delivery time. For beginner, achieving centric relation can be challenging. You can watch the video How to Record Centric Relation for additional techniques and guidance. If you need to change the video, verify the amount of video adjustment you want the lab to make while the patient is biting in centric relation at this time.